PBL is a way that the students can use real life cases to develop their understanding and put all their learning into a context.
It's not just the illness, it's also the patient. It's not a condition, it's a human being with a condition and how it affects them.
We start with a case study from a virtual patient.
With the case you're given, so their name, their age, there's a photo, it really makes it seem like it is a real scenario.
We go on to discuss the problems that the patient is experiencing, and then we do a brainstorm of sort of the things we'd like to explore in this patient's case and how we're going to approach exploring them.
It allows the students to go through and explore all the issues that are going on in the case, and then to actually come up with their own set of learning objectives.
Then we have the weekend to search and share the information with group members.
They either feedback by writing on the board, or they have a quiz, a game.
People are telling you what they've found and you're also telling them what you've found, so you're learning from other people all the time.
Really, I'm just there to ensure that they're accessing the information they need and make sure they are actually going along the right lines, but also, given that I've got some clinical experience behind it, I can actually bring that to it, and they might not have seen a lot of the things that they're learning about.
We can put our clinical knowledge in and we can say, oh, I've seen a patient with that, and they sometimes say, would you treat patients like that? And you go, yeah, well, we do treat patients, so we can provide the first-hand experience.
And if you get to a point where as a group we don't know where to go from here, that's where the facilitator comes in and goes, look, you're going down the right tracks here, maybe focus more on this point rather than this point, and then that'll sort of lead you in the direction.
I think it's just a really good way of putting what we've learned in lectures into an actual clinical context.
I think the way that Hull York Medical School do it in conjunction with lectures, anatomy labs, and most importantly also their clinical placements is fantastic.
You have the one group of students for the entire year, so you get to know them all, and you are their pastoral tutor as well as making sure clinically and academically they're up to scratch.
We understand it's the first time away from home. A lot of us are mothers and fathers, and so we totally understand this age group and what their needs are.
Having this group with 10 different minds gives you sort of the chance to express your opinions, take on board other people's opinions, and critically evaluate what other people are saying.
As a doctor, you're part of a team, so when they work together here, when they go out into the hospital, they know that for things to work better, they have to work in a team.